Hey listeners, did you know that with just $5 you can make a real difference in the lives of underserved communities affected by inflammatory bowel disease? The Stephanie A. Wynn Foundation $5 Friday fundraiser is your opportunity to contribute to the IBD Patient Navigator Program, which provides vital resources, guidance, and support to patients navigating their health journey. And here's the best part. You can donate every Friday. With each $5 donation, you're helping ensure that IBD patients in underserved communities have access to the care and support they need. Every Friday counts, and your contribution makes a big difference. So if you've been enjoying the Health and Healing from the Inside Out podcast, take a moment to give back. Head over to the StephanieAWynnFoundation.org to donate today and join us in making a difference one Friday at a time. See you soon. If you're unsure about any part of your diagnosis, schedule a call if you're not already in the office with your provider, or send an email to your healthcare provider. Ask them to clarify any medical terms or treatment options, because you have that right to know, right? So remember, you got to understand and get clarity on your diagnosis. Welcome to the Health and Healing from the Inside Out podcast with Stephanie A. Wynn, an online health and wellness podcast where I, your host, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. The Health and Healing from the Inside Out podcast is a mixture of special guest interviews from healthcare professionals, IBD survivors, Crohn's survivors, ulcerative colitis survivors, and community thought leaders. Be sure to select the subscribe button and let's start the health and healing process from the inside out. We are back for another episode of the Health and Healing from the Inside Out podcast. I'm your host, Stephanie Wynn, and today we're diving into a topic that's near and dear to my heart, IBD advocacy, taking control of your health. As someone living with Crohn's disease and actively working in patient advocacy, I know how challenging it can be to navigate the healthcare system. That's why in this episode, I want to equip you with practical tips that you can start using right away to advocate for yourself or loved one with inflammatory bowel disease. But before we get started, I'd love to invite you to our Exploring Health Equity Lunch and Learn series. Our final one is on November 23rd. We'll be talking about IBD advocacy, and there will be both in-person and virtual options available. CME and CE credits will be provided by Orlando Health for all of our clinicians out there, nurses, doctors, mental health and wellness, nutrition and dietitians who want to take part in this Lunch and Learn series and learn about advocacy. I know you all are behind on the other side doing the work, but look at it from a patient standpoint. Maybe you have a loved one that you have to care for that has IBD. Come join us, and we'll be serving a nutritious lunch as well. So if you want to take your advocacy skills to the next level, this is the perfect opportunity. You can register on our website, the StephanieAWynnFoundation.org. And so with that being said, we're going to get right into this week's episode with tip number one. Tip number one for taking control of your health and being an advocate for your health, for my IBD people out there that's listening. And maybe you don't have IBD, but you have a chronic condition and you need help with learning how to advocate for yourself. First tip is you need to understand your diagnosis. This tip is simple but incredibly powerful because you have to understand your diagnosis. So I want you to ask yourself, do I fully understand what my diagnosis means? Oftentimes, medical terminology can be confusing and overwhelming, but it's important to be clear about what's going on with your body. Gotta know what's going on with your body. You gotta get so in tune with your body that you know, like, what's happening. If your doctor uses terms that aren't familiar, don't hesitate to ask for an explanation. Your health is a partnership, and understanding your condition is the first step toward making informed decisions. So sometimes when you're diagnosed, do you really understand the words that's coming out of your provider's mouth? I'm just saying. Something you can do right away. So I want you to do this right away. If you're unsure about any part of your diagnosis, schedule a call if you're not already in the office with your provider, or send an email to your healthcare provider. Ask them to clarify any medical terms or treatment options, because you have that right to know, right? So remember, you got to understand and get clarity on your diagnosis. Tip number 2, know your treatment options. You want to make sure that you're familiar with all of the treatment options available to you. This includes medications, surgeries, lifestyle changes, and even alternative therapies. It's easy to feel overwhelmed when dealing with a chronic illness like inflammatory bowel disease, also known as IBD. But knowing your options give you the power to choose what works best for your body and lifestyle. Ask your doctor to walk you through each option, including the benefits, risks, and potential side effects. You gotta know this. This is something that you must know, because this is your life. This is your body. And something you can do right away is write down a list of the questions for your doctor about your treatment plan. Having a clear understanding of your options will help you feel more confident and in control. So remember, write down the questions, a list of questions, maybe 3 to 5 questions that you can get answered, or even as these questions come up, because as you go along this journey, you're going to have more questions. So you write them down. So you create a journal, if you will. Tip number 3, build a support system. Advocacy doesn't happen in isolation, whether it's family, friends, or community of people who understand your journey. Having others to lean on can make a world of difference. Support systems provide emotional encouragement and often help you navigate complex health decisions. So something you can do right away is reach out to a local or online IBD support group. Having a community of people who understand your struggles is crucial. What I mean by that is there are plenty groups out here. You have the Crohn's and Colitis Foundation. You have the Stephanie A. Wynn Foundation. You have the Color of Crohn's. Shout out to Koji and many others. So one of the things I want to say is you do not have to suffer in silence. You don't have to go about this alone. You're not alone, but you have to take back your health. And to do that, you have to advocate. You have to become your biggest advocate. You have to know and understand your diagnosis. You have to understand the terminology. And I know some people don't, I'm just too sick. I'm too ill. I don't want to deal with that. You got to deal with it. You must deal with it. If you want to live, you gotta deal with the situation at hand. And that's getting educated. You gotta educate yourself on this terminology. You have to educate yourself on the treatment plans. What are the options for you? And you also have to build a support system. Now, I'm not talking about a pity party or a woe is me party or a system where you just complain all the time. No, I'm talking about a support system that can be there for you when you're having a flare up and you can't get to the doctor, you go to the doctor and you can't even speak for yourself. You have someone there that can support you along this journey. It's not easy. It is not easy by no means. Trust me, I know. Trust me, I know. But you can get through this. You can get through this. So if you found these tips helpful and want to dive deeper into IBD advocacy, don't forget to join our Exploring Health Equity Lunch and Learn series on Saturday, November 23rd. We will be discussing IBD advocacy and how you can become an IBD patient advocate for yourself, right? Or your loved one. And we'll have both in-person options and virtual options available. So you'll earn your CME or CE credits thanks to Orlando Health, and enjoy a nutritious lunch for those who will be attending in person. It's a great opportunity to connect with others who are passionate about health equity and learn how to better advocate for yourself and others living with IBD. So head over to our website today to register. It's free to register. It's free to the community. It's the StephanieAWynnFoundation.org. And we'll put the link in the description notes. So listen, I want to thank you for tuning in to this episode of the Health and Healing from the Inside Out. Remember, your voice matters. And the more you understand your condition, the better you can advocate for your health. Be sure to subscribe, leave a review, and share this episode with anyone who might benefit, who you think can really benefit from IBD advocacy and just understanding what you're going through. We all are fighting something. But until next time, take care of yourself from the inside out. Peace. Thank you so much for tuning in to the Health and Healing from the Inside Out podcast, an online health and wellness podcast where I, your host, Stephanie A. Nguyen, will provide weekly wellness tips about inflammatory bowel disease, specifically Crohn's and ulcerative colitis. Be sure to select the subscribe button and let's start the health and healing process from the inside out.